Welcome to Adapting class. This is what we're going to talk about today. How much Pharm do you know for the NCLEX? Just give me one information about them, a priority information about them. Will you be able to do that? That is the key. You should be able to look at this medication. You said, I know at least 2-3 things you think the examiner was going to ask you about. Can you do that? I think you should take a paper and start writing and see if you can give us at least write 2 things about each of these medications and you see how you're going to do. I think that's the way you should study. One day you stop looking at a book, you list some of the things you're likely to be asked if it's pharmacology or infectious disease and see what you know about it. That's instant recall, right? So this is a very quick Pharm. I'm just going to give you the taste of it, a little bit of it so that you can see like, oh, I need to know this. If you don't know at all, 1 or 2 things about this medication. Adenosine. If I say, give me one thing about it, you should be able to tell me like used for SVT, right? Like SVT that is unstable. You can't break it. That is not enough. There's one more thing you're supposed to know. This is giving fast. You have to give it pushing so fast, like 1 to 2 seconds. Guess what? That's what the board is going to ask you. And they will ask you, where do you give the injection? It has to be close to the heart. So the anticubital vein is a good place to put it. Okay, when you give it fast, you got to run it by 20 ml of saline. So you got to flush it with it so they can go fast as much as possible. What do you tell the patient? The heart is going to stop. But it's going to come back. And these are key things you have to know about these drugs. Simple, and this is like a select or apply question. They can even put in, what do you tell the patient that if their heart stop after that, one of the side effects is what? Flushing of the face. That is your adenosine. These are what the boards will ask you. Know that it's a SVT, you have to give it very fast, 1 to 2 seconds. No more than 3 seconds. So quick in the anticubital vein and flush it with 20 cc of saline. Patient heart is going to stop. You see a flat line that is going to break the SVT. How much dose you give? You give 6 milligrams. If it doesn't, then you give him 12, the second dose. This is classic adenosine. That's all you need to know about this drug. Very straightforward. Select or apply, I have done. And you expect them to ask you, this is like select or apply. And it will just give you a question. It's something you already know. This is the first dose, second dose. That's all. Can you do the rest? So that's the first one. Nitroprusside. Do you know what it is? Think about it. You have to look at the prefix and suffix and see if you can put it together. What do you think it is? This is a nitrate. As soon as you hear nitrate, you know that you have to avoid the fields, the cylinder fields, the Viagra, and all those things, because this is a potent vasodilator. So it's a vasodilator. It's used in hypertensive urgency or emergency. This is a really good drug that you use is somebody who has hypertensive urgency, emergency, nitroprusside. It can also be used in heart failure, okay, but you have to know it's a nitrate. So it decreases preload and afterload. That's what they do. What is one thing you should know about this drug if you don't know at all? You give somebody is on Nitroprusside. All of a sudden, they have weakness, they have delirium, and they're disoriented. What do you think? One of the biggest side effects of Nitroprusside, weakness, delirium, disorientation, if you give it more than 3 days. What will you do? Expect your board to ask you that, because that is the biggest. This is one of the biggest problem of this. Weakness, delirium, disorientation, if you give it more than 3 days. This is toxicity. It means it's toxic. What do you give the patient? What are you going to give the patient to reverse the effect of Nitroprusside? Thiosulfate. I know you know it. Thiosulfate is an antidote of Nitroprusside. And that is what you give it to the patient when you see weakness, delirium, and disorientation. So we don't give this medication more than 3 days. If you have hypertensive urgency, we give you a few days, then we transition to another one. But when you see weakness, delirium, disorientation, you know they have toxicity. And the antidote for that is thiosulfate. 2 down, right? That is just Pharm. How much Pharm do you know? This is the way I want you to think about it. So you can write your Pharm down and figure out what you need to know about it. And that's the way you can study your Pharm. Otherwise, you memorize them. See if you can say something about it. Benztropine. What can you say about this drug? What can you say about it? Don't memorize it. Look at the last name. Do you know any drug that has tropine attached to it? Do you know any drug that has tropine attached to it? You know it, right? It's like, it looks like atropine, right? And what does atropine is? It's an anticholinergic. Therefore, Benztropine is an anticholinergic. Straightforward. So this is the same drug. It's an anticholinergic. What are the common things you're supposed to know? It can be used in, another name is congentin. This is the same thing. It's used in Parkinson, right? Parkinson, you can use it in Parkinson patients without any problem. Okay, but why do you use it in Parkinson? Because EPS NMS side effects. You can use it and use it, especially in EPS, extrapyramidal side effects for antipsychotic. So you can use Benztropine to take care of the extrapyramidal side effect, and also can use in Parkinson patient. But because it's an anticholinergic, you don't have to memorize it, right? You know what you expect, right? Dry mouth, right? Dry mouth, dry eyes, constipation, right? Urinary retention. And what is your biggest B sharp? All this doesn't matter. Don't worry about it. What you think your body is going to ask you is glaucoma. Somebody who has glaucoma, you should worry about it because it causes pupillary dilation. You should avoid it in a patient who has glaucoma. So this is your B sharp movement. The rest is fine. But you have to know this drug because they like asking you. So that's your biggest problem. It's anticholinergic. All these things, I give you what? Dry mouth, sugar-free candy, right? Constipation, take some fiber. We put folate in. But if you have glaucoma and you give him Benztropine, well, I'll lose my eye. So you should not do that, right? You should not do that at all. So that's that drug for you. I mean, you can also use it in asthma patient Or but most of the time they will ask you some of the side effects related to eye problem. That's Benztropine. If you have extrapyramidal side effects, you can give Benztropine. So if they give you a question related to tardive dyskinesia, yeah, you can give them Benztropine to take care of it. Right? That's number 3. Digoxin. This is Pharm. How much Pharm you know? Few things you want to say. That's all. I don't want to say so many. Digoxin. What do you think? Digoxin. Right? You know it. This drug, you got to like it. When you wake up in the morning, you should be able to say something about it. It can be used in heart failure, right? It can slow down the heart. It can basically control the rate, and it can also help with the contraction. It has so many function related to heart function. So it has power. I call it. It has power. It has rate control, and it has speed. That's why we use it. And there's no mess you have to know, right? 60. I call it 60, 70, 60, 70, and 90. This is what your body will ask you. If your heart rate less than 60, if you're a new adult, you can take it. 70, if you're a child, less than 90, if you're a neonate, you can take it. What is the side effect? Don't memorize it because that's what they're going to ask you. Just draw a caricature like that. Draw it like that. And start from the head. They have neural problem, drowsiness. Your eyes is there. Color changing, yellow-green color changes, cotomates, right? And your mouth is right here. Mouth is number 1. When you have GI symptoms, that's number 1. Therefore, nausea, diarrhea, any GI symptoms, that's number 1. Your mouth, you go to your heart. It causes what? Heart block, right? It has cardiac toxicity. From your mouth, your heart, your kidney is right there. Kidney dysfunction is always a problem. It will make digoxin a problem. These are all your side effects of digoxin. You see, you don't have to memorize. Just draw the thing and keep on coming down. Every big structure is going to affect it. And number 1 side effect is a GI side effect. And what it will trap you is with this: calcium, potassium, magnesium, and calcium. The book will tell you you should avoid low calcium, low potassium, low magnesium, and high calcium. I tell you, forget about it because the board will trick you. Say, make sure all this is normal. That's all. Because when they said, don't decrease your potassium, they will give you a question, it will describe it. Minimize, they will say, don't lower your potassium. So you think, well, I need to increase my potassium. They say, don't lower your magnesium. You think you should increase it. They will say, don't increase your calcium. You think you should decrease it. Wrong. All of them are wrong. Just make them as normal as much as possible. Make sure your potassium is normal. Make sure your magnesium is normal. Make sure your calcium is normal. That is the side effect of digoxin, right? Simple, straightforward pharmacology. That's all. Metronidazole. Can you say something about this? That's all. That's what I want. Like, if you can say 3 things about this medication, then you're golden, right? You have seen this medication before. If you can't say anything at all, just know that it can be used for C. diff, right? It can be used for C. diff, C. difficile infection, right? That is what the most common side effect of that, what we use for. And it has metallic taste because the patient is going to ask you. They hate it. They don't want to take it. It's a big pill. If you can't remember anything, just know that it's a sulfur drug. And as soon as you say sulfur drug, 2 things should come to your mind. It has photosensitivity and Stevens-Johnson syndrome. Bad problem. Photosensitivity, you just tell them, just wear sunscreen, wear a hat when you're going out. But Stevens-Johnson syndrome is your B-sharp moment. How will the board trick you? It will say the patient has small purple rash on the chest. Well, it's not small. It's the beginning of dangerousness. There's no word called dangerousness, but I'm using it to emphasize that. It's the beginning of bad things about to happen to you. So they will use the word small purple rash on the chest. That's a trap. It's a good question. It's a way to let you think that this is the beginning of a problem. So Stephen Johnson, you should follow up on that, right? Pharm on the ankles, like I tell you, this is the way you should study it. And then if they don't give you this, guess what? It's coming. What do you think? What do you think they're going to put out there? What do you think they don't put what I put over there? Well, the patient is going to be a man. He will be shaving. He has cologne. He will put it on. Okay. He has aftershave. He has like mouth wash. He's going to wash his mouth after brushing. You should be able to tell them that, hey, you should not do that, right? Avoid alcohol 3 days before you start this, and at least 3 days after the medication, because alcohol and metronidazole, they are enemies. They're going to hate you. They're going to hate you. They form aldehyde, and it can kill them. So you got to tell them, hey, you can't do that. So you got to keep, these are your teaching, education, they put in that select order apply. Like I've told you guys, if you know your content, those select order apply is nothing. It's just like basically what you know, they put it in the box for you to select. So you tell them, hey, you can aftershave, you can mouthwash, okay? You can eat some salad, sometimes there's alcohol in it. There's certain things you shouldn't be doing until you finish antibiotic therapy. That's all, right? So you remember it. I like that. So that's that, metronidazole. And this one is a big one because if you don't see it, they will give you another medication. Doxycycline. It's an antibiotic. The major group is tetracycline. So usually, if they don't give you this, they will give you tetracycline. If you see tetracycline, the same as digoxin, doxycycline, it's a group. They are in the same group. What is the biggest things about this? There's few of them. And you don't have to memorize it. Empty stomach. Okay, empty stomach, number one. If you want to eat, then you take it 2 hours after eating. Okay, they hate antacids. They're never good, right? They don't like milk. You can't take it. Okay, they causes esophagitis. If you causes esophagitis, do you know alendronate? The same thing. Full glass of water. And remain upright 30 minutes upright after taking it. Guess what? We use this for UTI and other vaginal infection. And therefore, women are very important. Tetracyclines or doxycycline, oral contraception does not work. You're going to form a baby that you don't like, right? You're not going to like it. Teratogenic. So you got to teach them. This is what your board will like you, because it's going to be a female who is taking birth control, and you should be able to tell them, hey, you can, your baby is not going to be happy. So I want you to add a barrier method. If you don't know anything at all about this drug, of course, it causes discoloration of the teeth. And that one is more important in kids. If it's a kid, yeah, discoloration of the teeth. So, but for older patient, big one is that. Pharm for the ankles, right? Pharmacology, easy. That's all. And this one, if you can see it, look at the last name and the first name, right? Last name is a Penicillin, penicillin derivative. Penicillin derivatives. Amoxicillin is antibiotic for penicillin group. Therefore, you got to know that you got to check for allergy, penicillin allergy. That is the key. Apart from that, GI symptoms, don't stop taking it. Nausea, vomiting, diarrhea. It causes diarrhea. It destroys the bacteria in your GI tract. But the biggest thing is allergy to penicillin. You just check it, make sure they have no allergy to penicillin, and then you're done. So you tell them to take it with food, okay, for the GI upset. That's all. Most of the time, the answer choice would be checking penicillin allergy if you're giving somebody for amoxicillin and other thing, right? That one is done. So the idea is for you to look at the medication, say a few things about it that you think they can ask you. Of course, don't even sleep on these guys. Risperidone. The board like it. Mental health, they love it. Because, yeah, we all have it. It's spreading like virus. You living your life, you go through some things and things happen. So psychotic medication and mental health issue is big. Do you recognize this? Do you recognize this? This is a second generation antipsychotic. And as soon as you hear that, oh yeah, there's a bunch of things coming, right? They're going to trap you with this. Weight gain. Don't worry about it. Okay? Hyperlipidemia. Don't worry about it. Diabetes. Don't worry about it. What you should worry about it is what? They even will ask, orthostatic hypotension. Don't worry about it. What you should worry about is QT prolongation. Most of the antipsychotic second generation do that. They can also cause neuroleptic malignant syndrome. That's what your board will tell you. It can cause EPS. You give it to them and their pressure is high, temperature is high, or they have what? EPS is ADPT, which is acute dystonia, akathisia, Parkinsonism, and tardive dyskinesia. If you want details, just check Adapting Class. This is brief, quick information for you. But this is what you have to worry about. And that's what your board will give you. In the multiple choice, they will give you weight gain, hyperlipidemia, diabetes. Forget about it. Look for QT prolongation. Look for NMS symptoms and look for EPS symptoms. And that's what you should worry about. That's the key about this medication. If they don't give you risperidone, they will give you another second generation antipsychotic. So you have to know them, and so that you can use the same side effects for them. It does not matter. If I give you olanzapine, it's the same thing. If I give you clozapine, it's the same thing. The only thing you worry about clozapine is agranulocytosis. In addition to all that I've said, specific for that medication. That's all. So, antipsychotic. Now, Dantrolene. Can you say anything about this? One thing, if they ask you to say something about Dantrolene, I will make it easy for you. It's one of those medications, is weird. You see it everywhere. If you don't remember anything, think about it. I will make it easy, but somebody will say, no, don't say that word. It's a muscle relaxant. That is the easy way so that you can understand it's used. That's all. It's a muscle. It's like Flexeril, okay? It's a muscle relaxant. It does different things, but that is this main. So it prevents contraction of the muscle. So think about it. If it prevents contraction of muscle, any disease process, and that is over contraction of the muscle, yeah, I can use it. Do you remember anything that is so dangerous, is so deadly, and it's due to excessive muscle contraction causing fever, and you can't distinguish between them because it can kill you? Which one is this? Malignant hyperthermia, neuroleptic malignant syndrome. These two. This medication is golden. That's what you use for. Very, very good. In addition to other Valium, or yeah, you can use Valium for that, like diazepam. Okay, benzos can also be used, but dantrolene can also be used for this. If they try to trap you, yes, cerebral palsy, okay, you can use it from the spastic nature of the muscle over contraction. You can still use it. So if you see everywhere and it's confusing you, think about it. It's a muscle relaxant. So anywhere there's over contraction of the muscle, yay, I'm using this medication for it. I'm using this medication for that. So you should not worry about it. But this is the key. I mean, it's a medication, they love it. They try to confuse you with it. One word, muscle relaxant, and the rest is history. You look at the case and you say, hey, if I need to relax it, and it's one of them, you can pick it. But don't forget, malignant hyperthermia, neuroleptic malignant syndrome, dantrolene is your friend. Of course, you're going to get some pain medication, so hydrocodone. It's an opiate. Why do you have to worry about this? You don't even have to memorize this. You know what it is. It's like morphine, opiate, where it's a downer. Okay, they downer, they put you down. So if I'm putting you down, all my symptoms has to be going down. Where you have constipation, is that not going down? You get urinary retention, is going down. Your blood pressure is low. Your respiratory rate is low, and that is your normal one, B-sharp movement. If they give you a bunch of symptoms, number one you should check is respiratory depression. I'm just giving you things the board like to give it to you. So this is key, right? Respiratory depression, right? Those are the things, that's what it does. And then if you constrict your people, all those signs and symptoms is what you expect for that, right? And then the rest, we can fix it. This one, yeah, you're going to die. So we got to check your respiratory rate, okay? These are a few things about this medication. And you like the patient do what? Fiber. Exercise, drink a lot of water so that you don't get retention. We'll monitor your respiratory rate and we fix you, right? Hydrocodone. Now, my favorite, right? No, it's not my favorite because everybody knows it. Furosemide. I call it laces because it acts for 6 hours. Your board will not use the word laces, but it's furosemide. That's the key. What do you know about this? It's a loop diuretic, right? And it's used in heart failure. You can also use it for hypertension. You know, there's so many. So far as you have too much fluid in the system, we can get rid of it. And one of the biggest things they like to ask you is potassium. So because it's low potassium. And then they will present it like muscle cramp. Okay, muscle cramp, that's signs of that. But this is what I'll tell you. In addition to that, don't forget, it's a sulfur drug. It's a sulfur drug. Sulfur drug, I told you 2 things about sulfur drug. You should worry about what? Photosensitivity. But this is not a big problem because you can teach them to do certain things. But Stevens-Johnson syndrome, yeah, deadly. So there's 2 B-sharp movement, this and that you're supposed to know about that, right? Key concept for this medication. Almost done. I'm trying to see how much you know your file. And then enoxaparin. Do you recognize it? This is a lower molecular weight heparin. It's heparin, okay? It's an heparin. It's a lower molecular weight heparin. No drip. You cannot give it to true drip. I'm just giving you things they're going to trap you. No PTT. You don't need to check a PTT. You give it sub-Q, right? Where? 2 centimeters from the umbilicus. That's where you push it. Key fat fundamentals. If you can pinch more than 2 centimeters of the fat, you give it 90 degrees. If you cannot, less than 2 centimeters, you give 40 degrees. Key fat, they're going to trap you. Then what are the other traps? When you are on lower molecular heparin and enoxaparin, no diet modification. They're going to trap you. They tell you not to eat vitamin K, not to eat fresh vegetable. Negative. You don't need to do anything. Go eat anything you want in the world. It does not affect you. The only thing you know is because it's bleeding. So yeah, bleeding precaution. So you teach the patient bleeding precaution. And what is that? Well, you got to use electric shaver, right? Not a razor blade. You cannot take NSAID with it, right? You got to make sure you take some stool softener so that you don't bleed. When you see black tarry stool, hey, it's not normal. Call me, the doctor. That's all. Those are the few things, bleeding precaution you tell the patient. It's cleared by the kidney if you don't know. So if your kidney function is abnormal, yeah, you got to check that. You got to stop it. That's all. Right? Almost done, guys. That's enoxaparin. Now, vancomycin. I think this is one of the biggest medication ever made, you know. It's an antibiotic. It has broad spectrum. That is, it can kill a lot of stuff. The biggest gun we have, I must say, is number one, VRE. These are vancomycin resistant. These are big drugs that we can use this medication for. Of course, if you have C. diff, we can give it to you too. It can be used to treat C. diff, right? Your board love this because they can trap you so many ways. Number one, it's a vesicant. That means there's a risk of extravasation. And so you have to know, you got to check the IV site 30 minutes after the infusion. It's key. It's very key. Number two, side effect. It's like aminoglycosylate. So they are like that, aminoglycosylate. If you know them, and gentamicin and amikacin, they are the same. They have the same side effect like vancomycin. So what do you think? I give you a clue. I give you a clue, like gentamicin. So they cause nephrotoxic and ototoxic. So it causes hearing problem and the kidney problem. So you got to pay attention. One of the fundamental things they can ask you, number three, is you should not infuse it. You should infuse it over 1 hour, 60 minutes or 1 hour. So infusion has to be 60 minutes. If it's less than 60 minutes, what is going to happen? Patient is going to look, the face will be flushed face from the head to the chest. There is no wheezing, no hypotension. I'm giving you some of the bars where they give it in the case so that you don't get trapped. I give you vancomycin faster than 60 minutes. That means I give you over 30 minutes. Your face is all going to get red. Your chest is red, but you have no wheezing, no hypertension. What is that? What is that? That's what the board will ask you. No wheezing, no hypertension, but you are flushing of the face because vancomycin is going too fast. And that is what we call red man syndrome. This is not anaphylactic shock. It's just hypersensitivity reaction. Just slow down the rate. That's all. That's vancomycin for you right there. Okay, vancomycin for you. Easy as bread you eat, right? Now, well, if you're taking the board, you got to know something about this guy. I don't know why. I mean, the board like it like that. Yeah, you see it in every Q bank, a bunch of questions about him. Lithium. Yeah, it's a mood stabilizer. You can use in a bipolar patient, right? Look, the main thing when you hear lithium, think about what? Kidney. If you do something to your kidney, lithium is not going to be happy. And what are the things that affect your kidney? Yeah, ACE inhibitor affects your kidney. Hydrochlorothiazide affects your kidney, right? NSAID affects your kidney. These are the guys you should avoid when you're on lithium. They don't like your kidney. How? ACE inhibitor decreases your sodium. Hydrochlorothiazide decreases your sodium. NSAID increases your creatinine because it affects your kidney. Well, when you're on lithium, you make sure your sodium is the same thing I told you about digoxin. Sodium should be normal. Don't worry about things telling you don't increase it, don't decrease it. No, make sure your sodium is normal and you're drinking as much as possible, 2 to 3 liters a day, so that your kidney will be happy. Sodium is normal, but don't say increase sodium. Increase sodium is wrong. If you increase sodium, lithium will not work. You have to make sure your sodium is normal as much as possible. Okay, as much as possible. Lithium and sodium exchange, and sodium, they exchange each other. If you decrease sodium, lithium goes up. If you increase sodium, lithium goes down. Therefore, if you take too much sodium, a lot of salt, your lithium level go down and you go into maniac episode. If you decrease your sodium, lithium become toxic. It make you sick. You see the thinking, but they don't explain it to you. So you make mistake and you pick answers because they said don't decrease your sodium. So you end up increasing your sodium. It's wrong teaching. There's no scientific basis. If you think about it, they exchange each other with the same electromagnetic. But if you go up on your sodium, well, you get rid of your lithium, the patient becomes maniac. If you decrease your sodium, lithium builds up and it becomes toxic. So don't do that. Well, how do you know lithium is toxic? Number one, GI symptoms. If you see any GI symptoms, nausea, vomiting, diarrhea, anorexia, a warning sign. That tells you patient is having lithium toxicity. That's all. This is my pharmacology for you. Enjoy. Right? And the last one, Captopril. Everybody knows this, so I'm not going to waste too much time on it. What do you know about it? Look at the last name. All of them are Pril, Enalapril, Lisinopril, right? The side effect is easy. They are ACE inhibitors. So A is angioedema. And a C, they usually causes cough. The cough is not big, it's just nagging, patient does not like it, So when you see that, you can change it to ARBs, angiotensin receptor blocker agent. They are better than Lisinopril. I don't have to give you the pharmacological basis on it. There's a reason why, because of which enzymes they block, and so they don't cause those side effects. The E is the electrolyte, so potassium is high. And I call it a teratogenic, okay? So you got to make sure you're wearing condom, and then you're taking pregnancy, and you're taking birth control, basically. If patient has cough, you just give them ARB. That's all. ARB are different. They don't cause these two. It's because of the area of the pathway that they block, the RAS system. I don't want to, you are not in nursing school anymore, so I don't want to go there. But renin-angiotensin system, that's like you heard it multiple times. But if you understand the basics, You understand the reason why ARBs does not cause angioedema or cough. That's why we can replace it with that. It's due to bradykinin breakdown, but I don't want to go into that. But this is my Pharm for you. These 15 Pharm questions, just look at it. The favorite board questions, at least you have to be able to say something about them. One or two things when you see them anywhere. This is what you should do in your Pharm. When you study in Pharm, you're struggling, just write a bunch of medication and see what you can say about them. One or three things that you think they can ask you on it. If you do that, you're good. You don't have to know everything. I give you things that key facts about them, and then you're done. Okay, take care of yourself. Thank you for watching.